Hello everyone, Nurse Mark 26 here, and today marks my first YouTube video. So just before we start, just a little background about me. My name is Mark Brian Espiritu. I'm a registered nurse and a UK RN. I got 8 years of clinical experience, 2 years in Philippines, and 6 years here in the United Kingdom. I've worked in emergency room and general wards. Now, our topic for today is fundamentals of nursing. This is the basic of the basics. And my book source for this is Kozier and Herb's Fundamental of Nursing. This is the 11th edition. It's a very good book. Right, now we can formally start. Let's discuss the nursing process. Okay, nursing process, this is our backbone as nurses, isn't it? It's our bread and butter. We use it every day. And the nursing process is client focus. Alright, nurses, remember, the purpose of our nursing process is to identify client needs and to deliver care to meet those needs. Alright, client focus. It is systematic because the nursing process has 5 phases, namely assessment, diagnosis, planning, implementation, and evaluation. Systematic means assessment must go first before diagnosing, isn't it? We collect the data first before we can formulate a nursing problem. Alright? Dynamic. Dynamic, it means constantly changing. So for example, here in your evaluation, if the goal is partially met or unmet, what do we do with the nursing care plan? We change, we modify it, isn't it? Next is individualized. This is the most important characteristic of your nursing process. Individualized means you incorporate the client's needs, the client's health beliefs, practices into the nursing care plan. For example, the client doesn't eat pork. So your nursing responsibility as a nurse is to liaise with the dietitian or the kitchen staff, isn't it? So that she won't have any pork on her meal. So maybe it's for religious purposes, right? And last is collaborative. Okay? So we liaise, we collaborate with other healthcare professionals like doctors, respiratory therapists, dietitians, and so on. Okay? So, let's go formally to our assessment. Assessment is the collection, organizing, validation, and documentation of data. Okay? So, data collection. We got 2 types of data here. We got the subjective and the objective. Alright? So, subjective, these are your covert or your symptoms. It's only the client who can report these symptoms. Okay, for example, the client verbalized she's having pain on her right knee. Okay, and objective, these are overt or your signs. It means it is us nurses who can observe these health cues. And these objective data, they are measurable. So for example, your vital signs, temperature of 36.7, respiratory rate of 33. So those are objective data. Okay? Organizing. So when we've collected all this data, we organize them, for example, by system. So this data belongs to the respiratory system, short of breath. This data belongs to the digestive system, bowel sounds of 7 per minute. Alright? And validation. Okay, I want to emphasize this. A very important nursing responsibility is to connect the subjective and the objective data. Okay, what do I mean? Okay, the client complained of pain on her right knee. Okay, that is a subjective data, right? So your objective data can be facial grimace or guarding behavior on her right knee. So they connect. Your job, your nursing responsibility is to connect these two so that you can validate the information. Okay? And last one is documentation. Okay, very important. Next, we go to the sources of data. We got two again, primary and the secondary. Primary, this is your client. Secondary, these are your family, patient records, and other healthcare professional. Now, primary, this is your best source. Alright, take note of that. Best source. The client is the best source of your information. Okay? But there will be instances where your client is not the best source of information. So for example, if your client is a 4-year-old, do you think the 4-year-old will be a good historian? No. So what if the client has dementia, Alzheimer's dementia, poor short-term memory? So it's not the best source as well. That's why we go to secondary data during those instances. Because secondary data, these are supplemental. Okay, I hope that's clear. Now let's go to the methods of data collection. First one, we've got observation. So this is us nurses using our senses, okay, to collect data. For example, it's your first time meeting the client. Using the sense of sight. Does the client look unkempt, dirty, organized, clean? The client's approximate height and weight. So that is observation. Next is interview. Here in our interview, I want to emphasize the nursing health history. Okay? Oh, by the way, the ideal distance for your interview is what? 3 feet. 3 feet. Okay, that should be enough. Now, the nursing health history. The purpose of your nursing health history is to establish a baseline data, right? And this is usually done during admission, okay? During admission. So here we collect the biographic data. The age, name, sex, occupation of the client, okay? Chief complaint. How do you ask this? Chief complaint. What brought you here into the hospital? Can you tell me what's troubling you? Alright? History of present illness. When did the pain start? On a scale of 0 to 10, 0 being no pain, to 10 being the worst pain, what is your pain scale? Does your pain radiate? Okay? History of present illness. Past medical history. Patient's allergies, very important. Immunizations, previous hospitalizations, accidents, current medications. Then family history of illness like hypertension, diabetes mellitus, mental health problems, right? Okay. So now let's go to diagnosis. I hope assessment is clear and very straightforward about it. These are just supplemental lectures, so it shouldn't replace your classroom type of lectures. Okay? Now, diagnosis. Diagnosis is the formulation of your nursing problem. Alright? But first, let's differentiate medical and nursing diagnosis. Okay? Because in medical diagnosis, it's the doctors who do this. Alright? So medical diagnosis focuses on the disease. Disease like asthma, lower respiratory tract infection, stroke. So those are all medical diagnoses. While your nursing diagnosis, it focuses on client's health response. Okay, client's health response. Okay, for example, the medical diagnosis is chest infection. Alright, your nursing diagnosis with chest infection can be ineffective airway clearance. Alright, because that is the client's response to the disease. Okay, I hope that's clear. So here in diagnosis, we do 3 things. First one is data analysis. In data analysis, we compare the assessment or the data that we collected to the norms and standards. So for example, okay, bring out your book. You see there that the normal range for the temperature is 36.5 to 37.5. Now the data that you got from the client, her temperature is 37.8. So what does that mean? The data is abnormal, okay? So that is the purpose of your data analysis, comparison. Next, we've got problem identification, okay? Problem identification. How do we write a nursing diagnosis? So here is a three-way format. Problem, etiology, signs and symptoms. Alright? So for example, on our earlier case, okay, chest infection. Problem there can be ineffective airway clearance. Okay, ineffective airway clearance. Alright? What is the etiology? What can be an etiology? The cause of the problem. Okay, excessive mucus production. And what can be the signs and symptoms here? Productive cough for 3 days. There we go. Problem, ineffective airway clearance related to excessive mucus production as evidenced by productive cough for 3 days. Okay, this is how we write our nursing diagnosis. We can find, or you can find all of the nursing diagnosis available in the book Nanda. Okay? Right, now that's out of the way, you can pause the video and copy. Okay, next we will discuss about planning. Planning is the setting of your goals and objective. Okay, your nursing goals and objective. And three things we need to discuss about the nursing goal is that it should be realistic, measurable, and timely. For example, okay, our client has had stroke. Okay, so our client is stroke patient. Okay, your goal can be written like this in your nursing care plan. Client. Remember, the nursing care plan is client focused. So you start the statement with client, not the nurse will. No, that's wrong. The client will raise right arm to shoulder length by Friday. Okay, let's examine. Realistic. To a stroke patient, supposedly today is Monday. Okay, today is Monday. Is this realistic? Client will raise right arm to shoulder length by Friday. Shoulder length, stroke patient. Yes, that is realistic. Considering it's Monday today, so you got 5 days, isn't it? So realistic. Measurable. Measurable. How high can the client raise the right arm? To shoulder length. Okay? Measurable. And timely. When will the client raise the right arm to shoulder length? Friday. Okay? So I hope that's clear. That's your planning, setting of goals, and objective. Next one, we go to implementation. Alright? Implementation, this is your actual nursing action. Alright? Your nursing action can also be called as your nursing intervention. Okay? So we have 3 types of your nursing intervention: independent, dependent, and interdependent. Here, independent, it's the nurse can do them themselves. So these are mainly what? Health, teaching. Okay, so this is a very good example of your independent nursing care. you're teaching a client how to deep breathing exercise, how to do deep breathing exercise, right? You're health teaching in a community about smoking cessation, okay? So that is independent. The nurses can do them by themselves, okay? Dependent requires an order from the physician, the doctor, isn't it? So a good example here is medication administration. Okay, medication administration. Do we need doctor's order here? Yes. So that's a dependent nursing intervention. Medication administration. Interdependent is when we collaborate with other healthcare professional. Alright, so for example, when we liaise with the dietitian to incorporate a low sodium diet with the client, okay? So that is interdependent. And last thing I want to emphasize here in implementation is that all nursing interventions must be documented. Very important here. Okay? Put a star on your note over this one so that you will remember this for the rest of your life. Very important. All nursing interventions must be documented. Okay? Last is the evaluation. So now we will determine the effectiveness of the nursing care plan. For example, client will raise right arm to shoulder length by Friday. If your goal is met, if this one is met, we will terminate the nursing care plan. We will move on to another care plan. So maybe here we focus on the right arm, so the next care plan will focus on the right leg, right? If the goal is met. If the goal is partially met, for example, the client can only raise the right arm up to here after 5 days, by Friday, just here. So what we do with the nursing care plan? We modify, we change it. Okay, so maybe we need to adjust the date. By Friday, we'll change it into by Sunday or by next week, right? What if it's goal unmet? The client doesn't lift it at all. It's just like that. So again, we need to modify the nursing care plan. Maybe we need to add some painkillers, okay? Some analgesia before we start our goal here. Alright, so that is evaluation. Goal met, goal partially met, and goal unmet. Okay? So that's just very brief and concise because like I said, this is the basic of the basics and I want these lectures to be supplemental. So I'm brief and concise and direct to the point. Alright? So that's all for now for our video. I hope you learned something. Nurse Mark 26 signing out.